Okay, I just went live.
Okay. Hi, for those of you who are just joining us, hang in there. We are waiting until we stabilize in terms of the number of participants, and then we'll go ahead and start. Hi, for those of you who are just starting or just logging on, please hang in there for a few minutes. We're going to wait until the number of participants stabilizes, and then we'll go ahead and start our webinar. Hi, for those of you who have just joined us, looks like maybe we have stabilized in terms of number of participants. Oh, now it's going up again. So just a couple of introductory things while we're waiting to see whether anyone else joins. In general, for these webinars, we use the Q&A function. We use the Q&A function instead of the chat menu. So if you have questions, please use the Q&A button that's down in the bottom of your screen, your Zoom screen. Okay, I think it looks like we're sort of stabilizing in terms of number of participants, so I think we'll go ahead and get started. Welcome to everybody. As a reminder, this is a webinar that's focused on the School of Public Health at the University of Washington. So if I provide answers or guidance about policies or what we're doing at the school, please keep in mind, if you are not someone who has a primary appointment in the school or even primary appointment at UW, that if you have questions about what's going on or what the policies are for your organization, to be sure to refer those to the leadership where you have your primary appointment. And then other thing for those of you who are just joining us, in these webinars, we don't use the chat box. We use the Q&A function. So if you have a question, and there'll be lots of time for Q&A, please put it in the Q&A box. And also, I noticed Lourdes has raised her hand. We actually don't use the hand raising function. So if you have a question, please put it in the Q&A. Or Lourdes, if you have a question for someone specifically in terms of administrative stuff, then please put it in the chat and direct it at a specific person. So welcome, everybody. So I'm delighted to announce that we have a special guest today, who is Anne Browning. Anne is the Assistant Dean for Wellbeing at the UW School of Medicine and the founding director of the UW Resilience Lab. I'll give a longer introduction to her in a few minutes after I give some basic updates in terms of what's going on in the school and COVID-19. And I also wanted to mention that we have a couple other panelists with us here today who are available to answer questions. So if you have questions that are specifically for one of them, just put question for Janet, or whoever. So our other panelists with us today are Janet Baseman, who's our Associate Dean for Public Health Practice and a Professor of Epidemiology, Stephanie Farquhar, who's our Acting Associate Dean for Education and a Clinical Professor of both Health Services and DEOHS, and Lisa Manhart, who's the Associate Dean for Research and a Professor of Epidemiology. Okay, so general updates. I want to start with something positive, which is hopefully you guys saw this because it made front page news in the Seattle Times. But according to the modeling work that's being done by IHME, we believe that we here in the state of Washington have passed the peak in terms of number of new cases and number of deaths from COVID-19. So, and in general, it looks like we have done an amazing job here in Washington of flattening that curve. So yay to everybody who has done their part in terms of social distancing, and of course a reminder that we still need to keep going. So as I like to say, it's not like we're at the top of the hill and it's just downhill and easy from here on out. We're halfway through the process, and we need to make sure that we get well into back down to baseline and to a situation where we can manage the cases through standard case contact investigations and quarantining before we'll start to see some of those social distancing restrictions loosened up. So happy to talk about that more later in terms of when might we expect to see changes in terms of policies. But yay that we're halfway through, and a huge congrats to everyone who has, it has not been easy for anybody. And also, of course, huge condolences to those who have lost loved ones or who have people who are sick, or just, it's just been an incredibly difficult time, which is why we asked Anne to join us today, who's gonna give us some words of wisdom. So other updates. So worldwide, as of this week, there are nearly 1.5 million total confirmed cases, with total deaths worldwide surpassing 85,000. Interestingly, China lifted its 76-day lockdown in Wuhan, which is, of course, the city where the COVID-19 outbreak emerged from. And so we will be watching them and other countries who are ahead of us in terms of the epidemic to see how, as they lift up some of these social distancing constraints, what happens in terms of the number of cases that they see, and whether or not there's a need to sort of bring things in and out. Nationally, we have more than 400 cases. That's about double what it was from a week ago. Nearly 14,000 people in the United States have died. I'm sure you're all aware from watching the news. There's a number of hotspots that have been identified nationally. We hear a lot about New York. New York City in particular has been really having a challenging time. But I also, from talking to my colleagues in other places, Chicago, Detroit, Louisiana are all having very challenging times, and our hearts go out to them. There is some good news that it seems as though the cases in New York perhaps have peaked. And again, also coming from IHME and their modeling, for the United States, the projection is that the peak will be in about 4 days, and that the total number of deaths may be as low as 60,000 in the United States, which is significantly lower than the projections that they originally had, which were closer to 100,000 deaths. So all of that, you know, speaks to it has been an extraordinarily challenging time. It's probably going to be a very challenging week nationally, but that the interventions that people are taking on are really paying off. In terms of some of the things that we're seeing coming out, perhaps one of the most disturbing is that health disparities and health equity issues are continuing to surface. One that has been in the news a fair amount in the last 24 hours has been that we're seeing much higher rates of death due to COVID-19 in African American populations compared to other populations. And those are likely due to underlying health disparities, and just emphasizing that we have a lot of work to do in this country in terms of eliminating health disparities that's being brought to the forefront by this epidemic. We also are seeing that individuals who live in areas with high levels of air pollution are more likely to die than those in areas with lower levels of particularly small particulate matter air pollution. So regionally here in Washington, we now have had over 8,600 confirmed cases of COVID-19 and close to 400 fatalities. But because it looks like we have passed the peak and we are not maxed out in terms of our the carrying capacity of our healthcare system, Governor Inslee has actually returned 400 ventilators to the national stockpile so they can go to those areas that have greater need. You probably also heard this week that Governor Inslee extended the stay-home order through Stay Home, Stay Healthy through May 4th, and also announced that K-12 schools will remain closed until the end of the school year. As you all are certainly aware, the University of Washington had already decided to offer spring courses online, but everyone who has kids, particularly kids at home, has been, watching to see what was going to happen in terms of the public school system. And I think it's very helpful that the governor finally made that announcement so that people can sort of make plans appropriately. That being said, I'm hearing from lots of people that about the struggles of trying to balance childcare, homeschooling, and work, and we'll come back to that more in a bit. Keep your eyes posted. We're expecting a message to come out from President Cultivate this afternoon about commencement and for the entire campus and what the plans are there, and also plans for summer quarter as well. So I think with that, I'll move into introducing Anne, and we'll come back afterward to our other panelists and have them provide some updates. So Anne has been at the University of Washington for a long time, since 2002, and has been working on supporting students with their transition into and throughout their time at the University of Washington, and using a lens of access and equity. Following her doctoral work in education, Anne began to focus more on issues of resilience and well-being, and recognized the need to extend beyond the student focus to include our faculty and staff. As the founding director of the UW Resilience Lab, she's worked with faculty on the integration of well-being into teaching and learning spaces. She now serves as the, I believe, inaugural Assistant Dean for Wellbeing in the UW School of Medicine, supporting our healthcare teams and broader community in response to COVID-19 and more broadly. Although she certainly did not anticipate that we'd have a pandemic come during her first 6 months on the job with UW Medicine, she couldn't be more proud to support and serve the community in this moment. And with that, I'm going to hand it over to Anne, who should be able to share her screen. I think she had some slides for us, and just to sort of share her words of wisdom. Anne.
Sure, thank you. First, thank you so much for inviting me. I do have a couple slides, but honestly, I kind of wanted to make this more of a conversation. I have a couple talking points that I'll share. But first, I just want to kind of acknowledge that we're at kind of this really tricky moment where, I sit on these kind of incident response meetings every morning and every afternoon with UW Medicine. And it's just kind of this turning point where I think, we haven't had to open extra ICUs. We're starting to kind of put a pause on surge planning. And it's amazing, because weeks ago, I think we would have been dancing with physical distance in the streets if we had kind of seen this coming. But it comes at the exact same time that, we're looking at our colleagues, folks we trained with, classmates who are serving as kind of healthcare professionals and in other means, kind of in cities that haven't seen their curves flattening as much. And so, at the same time that I'm just so proud of kind of this Pacific Northwest, Seattle response and the response in UW Medicine, it's also really hard to look around and see how other communities that we are all completely interconnected with are really, really struggling still. As addition to kind of framing who I am and what I'm doing here. I've come into this wonderful work as an assistant dean for well-being with the School of Medicine. And this year I've also had a chance to work down at UCSF with the Global Brain Health Institute and have been kind of in a global community there. And that's given me some really interesting insight into how this pandemic is playing out in different regional settings, different countries, different continents even. And that's been really, really interesting as well. I would say kind of in the arc of what I'll share, you know, I'll only put up a couple slides as I mentioned, but this has been a real amazing challenge because I feel as though we kind of started off at a complete sprint in early March to try and get infrastructure in place. And folks were, you know, completely exhausted and not sleeping and not really taking care of themselves. And it was, you know, probably a week or two into March where we realized, you know, we had just sprinted our hearts out and we were actually in a marathon. And so it's been this really interesting time to kind of pause and recognize, holy cow, this is going to be weeks and weeks and weeks to go, potentially months, and to try and actually kind of catch our breath while we're actually running at speed. So one thing I've definitely kind of noticed, especially early on, and I think we're all learning to moderate it a bit more now, is, you know, if we think about resilience, and I've done a lot of kind of work and research on resilience, you know, when we get kind of knocked down or have kind of a big stressor hit, you know, we really need that kind of break in the stress to be able to kind of return to baseline. And a lot of what COVID-19 has done is it hasn't allowed those moments of kind of returning to baseline. So for a lot of folks, regardless of kind of where you work and live, we just saw that ratcheting up of stress without being able to kind of come back down. And with it, just like, you know, kind of all of our fuses got really short. I certainly recognize that. I've kind of said I probably shouldn't have been allowed to be a parent to a 4-year-old in the time of COVID-19 because it is just hard to be patient and, you know, kind of bring your best self to the table. So I would say I'd want to kind of, you know, recognize that out of the gates. And one other thing I find myself, I really kind of pushed to think about the framing, to kind of shift even our language, because I think language is important, away from thinking about social distancing and really thinking about intentional physical distancing, but now more than ever, like a real intentionality around social connection. You know, I've noticed, it's kind of funny, you can't actually pass a virus through eye contact, but even walking around in Seattle and certainly respecting physical distancing, but I get the sense that people are kind of like averting their eyes. And, you know, I want to kind of acknowledge that we can actually still see each other and make eye contact and say hello from a distance. And I hope that some of that interconnection starts to kind of come back in the coming weeks as well. So as we're kind of thinking about these short fuses that we often find ourselves having, I wanted to share just a couple slides on thinking about resilience. What are some of the keys to resilience? And then what are some of the behavioral practices that we can put into play around resilience? So I will attempt to share my screen very quickly. Let's see. There you go. All right, so, and I'll go kind of quickly through this, but some of the keys to resilience that I wanted to share are things that really we can kind of think about being intentional in kind of fostering or cultivating for ourselves right now. And I mentioned that piece about social connection. Healthy attachments and connections, our relationships are things that are just incredibly important to continue to cultivate. And relationships take work, they take energy. So making sure that that's something that is kind of front of mind to maintain those connections. I really worry about kind of older populations that already tend to be more isolated in times like these, and how can we actually be intentional about connecting with people, in safe ways that make sure that we kind of foster that piece of resilience. The second one is kind of fostering positive emotions. That's in essence kind of being able to think to the good things that are happening, even when stuff is hard, and kind of helps redirect kind of where our thoughts and our attention is going. The last one is really cultivating a sense of purpose. This can be kind of doing something that connects you to something greater than yourself. We certainly see this a lot in kind of our responses across medicine, but we've seen this in huge ways from our community pitching in to, donate the PPE they had in their garage, and that's that personal protective equipment like face masks. Even for, in all honesty, like staying home is a way in which you can actually have a great sense of purpose and taking care of kind of the broader community around you. For this positive lens one, this one tends to be the most ethereal. One thing we find is often folks get kind of stuck ruminating on kind of these negative thoughts and feelings, negative emotions, especially in times like this. And that rumination can be a real challenge to break. So one great thing to do is actually just practice gratitude. There have been a lot of different ways in which we've been gathering comments from community and from kind of our healthcare teams around kind of their thanks in this moment. I think that sharing of thanks is actually a very powerful way to help yourself kind of reframe the experience. Write people thank you letters. It's if you have some extra time on your hands, it's a good thing to maybe take a pause and actually think about how you can express your gratitude to the people who've been influential and supportive of you. And really kind of shifting this culture, I would say one thing I've been advocating for within the School of Medicine is really no email goes out that doesn't start with a thank you so much for everything you're doing. And hopefully also kind of a recognition of those actions and their impact within the messages we share out. So my friend Polo Decano, he's a PhD in school psychology, and he's done a ton of research on resilience. And he's also obsessed with acronyms. So this on the side, it actually says refreshers. And these are things that you can do that help you actually kind of experience resilience. Again, focusing on your relationships, exercise, moving your body in some meaningful way to you, ideally every day. Fun and recreational and enjoyable activities. I think it's a challenge in this context of COVID-19 to actually think about what can I do that is just for fun in a way that is still kind of respecting physical distancing and being safe. And I think that kind of tension of the loss of enjoyable activities that we've had on the calendar, I'll speak more to that, can be a real hard part of what we're experiencing. Relaxation and stress management, do you have a good practice of being able to pause for a minute and breathe and kind of bring yourself down? Eating well and sufficient sleep. As we see stressors increase, we often see folks really kind of challenged to take care of themselves and be thoughtful about what they're eating and losing sleep, both of which are kind of around fuel and recovery for our own kind of well-being. Helping others tends to be a huge kind of psychosocial benefit to us. So in any, in small ways and big ways, we've seen kind of our community rally in this moment. Earth, time and nature. I cannot tell you how lucky we are that for the most part, many of us can actually leave where we are kind of housed at the moment and get into green space pretty efficiently. And we can do that even in the context of COVID-19, if our own kind of health and well-being permits. But this time of year in Seattle is actually kind of magical. And I would say maybe in the context and just how quiet everything has been in the city with so much less traffic and so much less movement. I hear birds differently now, and I just find myself kind of paying attention to nature in a different way. And the last one that Polo kind of looked at, often kind of anchored on religiosity or spirituality, but in a very secular sense, it's just a connection to something greater than ourselves. And that sense of purpose can be a great anchor point when things are really, really hard. And that last cartoon clip, if you've been on the airplane, they tell you if the cabin depressurizes to put your own mask on first before putting a mask on somebody else. It's hard because I think we've been socialized to, put a mask on everybody else, and if there's any oxygen left, then we get to breathe. But now more than ever, I think actually giving ourselves permission to really take care of ourselves and think about our own well-being is incredibly important. I was actually in a conversation with a bunch of folks who are doing work around well-being in the School of Medicine 2 days ago. We actually kind of reacting that maybe this will actually be a positive outcome of this time, is that we are trying new things around our own wellness. A lot of folks have been picking up meditation and finding new coping strategies and trying things that we hope will last far beyond kind of this experience of COVID-19 within our community. The last slide I just wanted to offer up to folks. This is the website, and kind of my well-being world is within faculty affairs. So it says faculty on it, but it's for everyone in UW Medicine. We put together this site and we have a ton of resources. I'll speak to a couple different kind of resources that will be on this site if you want to kind of follow and click through it later. All right, I'm going to stop sharing. There we go. Look at me figuring out the technology. I'm feeling very savvy today. So a couple more comments in the time I have before I hand it back to the rest of the panel. One thing, I was talking with Jürgen Unser, he's our chair of the Department of Psychiatry, and in kind of reflecting on where we've been and where we're going, he mentioned that, over the last several weeks, there's just been this really hard time of kind of this anticipatory fear and anxiety. And one thing that's actually been kind of striking is that he was saying some exposure is good, and that as we've kind of gone through these weeks, for most of our healthcare teams, for most of our folks in the community, we're figuring out that, physical distancing works. We're figuring out that the personal protection equipment we have our healthcare team members wearing works. And so that fear and anxiety starts to drop as we start to have fewer unknowns and kind of more anchor points over time. But I would say one thing that really struck me probably about a week ago, there was this really beautiful article that titled basically, That Discomfort You Are Feeling is Grief. And that's linked on our site, and it'll be in kind of the notes that we share out after as well. And it just struck a chord that even amidst this moment where we're kind of so concerned and have a lot of anxieties around COVID-19 itself, that there's also just this real sense of grief and loss at kind of the travel you had planned, the birthday celebrations, the graduations for many of our students, weddings that you had planned to attend, other celebrations, like the things that tend to be what we look forward to in life. We kind of are seeing them pass us by on our calendars in this really weird way, like they kind of belong to a different reality. And I feel like it's taken me a while, to kind of come to terms with what has been lost and kind of that other reality that doesn't really exist. And I think kind of acknowledging that grief and that hardship has been good. And I think making space for kind of that hard emotional experience of what has been happening to all of us, alongside dealing with the stress of COVID-19. So some things we can do, and I've been doing some debriefs with various teams that are in our palliative care, some of our folks who are working on COVID units. And a lot of folks will say kind of like, what can we do? How can we kind of best take care of ourselves? And what's interesting is trying to kind of think about what are the things that are actually in our control. how can we actually take some control of stress and anxiety? And there's a great psychologist, Dr. Damore, who shared with us some really good insights, and I'll share some with you. One of the ones she really mentioned was that, first off, anxiety is a good thing. It's actually a really powerful emotion, and that it signals to us that we have to take care of ourselves. We have to protect ourselves to some degree. Social distancing works because we collectively had enough anxiety that we paid attention, and we continue to pay attention, and that's a really powerful impact. What's problematic is when that anxiety layers and we almost overestimate the threats and underestimate our resources, and that's when we get kind of in a really bad cycle. So what can we do? It's still important to have routines. Honestly, making decisions is kind of a stressor, and the more you actually establish routines that you can follow, it actually helps reduce your level of stress. And kind of the habits and routines we form now will actually kind of become kind of these behavioral practices that will stick with us, hopefully through COVID-19. So these are kind of short-term routines. But I was kind of joking, my wife has been working from home for the last month already, I think. And, a week or two ago, she was like, yeah, I had a really good productive day. And I was like, oh, great. What'd you do? And she was like, I put on pants, like really nice dress pants, but just like getting dressed and having a routine and having a system and taking kind of the questions or the decision making out of it actually can help you kind of form a rhythm of your day that can be supportive. Let's see, another one, recognizing that when you have like a massive stressor like COVID-19 in your environment, that kind of the little micro stressors in your environment tend to add up, and they tend to each individually feel like kind of a breaking point. So, not being able to get a haircut unless you have somebody in your immediate family who can help pull that off, your garden, etc. So one of the things that's been recommended is, to the extent that you can, control those micro stressors and address them in your environment. And that will actually greatly reduce your stress, even if it seems like a small thing. Right now, we can control the small stuff. So trying to help yourself take care of those micro stressors can be really powerful. And the third is to recognize that we need and deserve a lot of support right now. So be willing to ask for help from one another, from your families, from your community, and really think about your own kind of psychological well-being as well. We've had a tremendous response from our Department of Psychiatry. We've had over 80 psychiatrists volunteer their time for kind of supportive conversations for our healthcare workers, and we have a pretty robust peer-to-peer support program. But thinking about kind of like who are your support structures, and how can you be intentional about kind of leaning on them and supporting each other. And then kind of the last thing I'll kind of mention is that we really should be as intentional as possible right now about kind of how we are consuming media and what kind of news we are listening to, because it can just be incredibly overwhelming. Dr. David Levy, he's a professor in the information school at UW, and just a wonderful human. And he's written books before on mindful tech and kind of mindful use of technology. And he just did a really nice interview. And again, this will be linked on our website and linked in the notes here, looking at kind of how can we avoid kind of having too much information at this time. And he kind of talks through, again, we're such creatures of habit. If we have a habit of hearing our phone ding and we pick it up and then, take our train of thought away, what does it mean? Like, you have almost this kind of Pavlovian response to checking your phone to see Twitter. Is that healthy? And he kind of really encourages folks to think about, before they pick up a device or, read news articles, to actually pause and say, will reading this actually be a healthy, beneficial thing for me? And he was talked a little bit about really reducing his own intake. You know, he reads some Seattle Times articles but no longer reads the New York Times, even though he's a New Yorker and he has for decades, but being really thoughtful about kind of what he consumes. And I do think it's just really challenging when we have these kind of supercomputers on our person almost all the time, that we can really get kind of sucked into the immediacy of contacts. One thing I've done is I have actually turned off all of the notifications on my phone. And so that thing is basically a paperweight until I choose to engage with it. And I try to actually be thoughtful about when I am choosing to engage with my phone. And that I think has actually kind of helped me not be driven by technology, and instead kind of choosing how I engage with that. David Levy is way more kind of nuanced in his thinking and his approach. So I would recommend looking at his work and looking at that recent article as well. I'll pause there, and I'm just, again, so grateful to be able to have this conversation with everyone. And thank you so much for inviting me, Hilary. It's really lovely to see you.
Yeah, thanks so much, Anne. All of those were super great insights, and in some of the cases, there were things I was like, yeah, I loved that article too, and other ones I'm going to go check them out after we finish this. I don't know if can you open up the Q&A
Yes.
section? There's a little thing down there, and you can see we have a question and a comment for you. So the first question was, could you please talk about the fact that many of us are experiencing more than one trauma? So not just COVID-19, but also, other things that are going on, but life is still progressing. So if you could just comment about that a little bit, that would be great.
Oh my goodness, yeah, and it's, I'll say that I'm thinking in real time about kind of what COVID-19 means for us as kind of a collective trauma, that I think will have a global effect on all of us who are living through it for decades to come. I am wildly hopeful that it also will create a bunch of opportunities to kind of change our practice and be more intentional about how we live in the world. But you are, think in terms of medical conditions and pre-existing conditions and how much more vulnerable that makes folks. I do think one of the things we're looking at is kind of trying to have a trauma-informed lens to kind of our own well-being. And it's really hard if you're doing the reckoning work of, kind of existing traumas. And again, that becomes kind of one more layer of hardship. It's in a way I mentioned kind of those micro stressors that are hitting us all the time. And then once we have another kind of major stressor hit, it seems like all of those actually become much bigger. So I would actually wonder or posit, like, if you're somebody who has multiple traumas, which many folks I think do, does that layering effect actually make this kind of more impactful on your well-being and make it much harder to kind of have some experience of resilience and getting back to baseline and being able to kind of recover from this? So it's a good question. I would actually, anybody else wants to weigh in who has a bit of a different idea around that, I'd be happy to hear it. But thank you very much for the question.
And then if people want to check it out, Jitana also gave a nice link to students who created their own milestone celebration, so it's a graduation. And I did want to reassure you guys that, like, there's a whole team of folks. Denzel Sweet's group has been doing just an amazing job coming up with an alternative approach to graduation, which we're expecting Anna Mari to send out more information about today. But they've been really thinking hard about, like, how under these altered circumstances do we still make sure that we're celebrating and that we're creating that sense of community. yet, but I'm looking forward to checking out that link that she provided. Are there other questions for Anne? Oops, it looks like I could scroll down. Okay, we got one saying, love your talk, Anne, thank you. Okay, and then from an anonymous attendee, where can we find resources on how parents can support or mitigate the impact of the situation on their children? It can be difficult enough to be a parent without COVID-19, and now there's just all this additional stuff on top of it.
Yeah, actually, couple locations. Mia Twan, who's our dean in the College of Education, she and some of her team have been working to actually pull together some resources for parents and talking to their kids around COVID-19. I want to say that landed on our central human resources page for the university that's looking at kind of this COVID-19 response. I can try to figure out if I can find a link and put it up there. And, you know, given my role, I think I get deluges of folks sending me information around resources, which is awesome. And there was the National Academy of Medicine has a wonderful resource list, and it is kind of delineated by supports for healthcare providers, but it's also had links, I think when I was scrolling through it before this call, around kind of supporting conversations with kids and supporting parents in this time. This is a challenge. I feel like when Jay Inslee made the announcement that school was closed through the end of the summer, you could hear like a collective groan, you know, around kind of school age parents. Even though I think pretty much folks saw it coming, it is an incredible challenge. I would say, you know, thank you for bringing this up. One thing I didn't mention is there's been kind of a good amount of literature and kind of recommendations coming out that if there was ever a time to give ourselves a bit of grace for not needing to be our most efficient selves in our work world, where we're also parenting, where we're also homeschooling, where we're also dealing with COVID-19 and our own kind of physical and emotional reactions to that. There is a lot going on right now, and I think it's tricky to kind of be as compassionate towards ourselves as possible and just recognize that there's a lot being asked of us. And I hope that when we can be kind to ourselves, it helps us kind of lengthen our own fuse and kind of give ourselves a bit more grace, and that grace then kind of extends onto our family members and our kiddos, who are honestly also kind of in this very odd spot where, you know, my kiddo is still in childcare, but in a wildly reduced hours and wildly reduced classroom in terms of the size and different kids. And it's a tricky thing to try and explain. I mean, I see my little kid with, like, her hands are basically really suffering because, you know, we're washing them so often, and trying to kind of explaining why can be a big challenge. I usually default to honesty, but kind of at a level that is age appropriate in terms of germs and sickness and protecting ourselves and protecting others. But it can be really complex.
So someone, Jashana provided a link. So if you go to hr.uw.edu, in the coronavirus section, there's a section called self-care, and that includes links to parent support at the bottom of the article. And Connie also says, Center for Child and Family Wellbeing at UW also lists resources for parents. So we'll try and make sure that those two resources get linked in the key takeaways that we post that when those get posted. So make sure that we provide those as well. Let's see, it looks like we got another one. So another question for Anne, another anonymous attendee says, I'd be interested in hearing your advice to those who have managers who may say things like, take care of yourself, and at the same time behave as but my expectations are no different and actually higher since there's extra work to get through at this time. Acting with grace is a great idea, but how many are worried about career collateral damage? How can we make it practical?
It's interesting. I get to run these or support running these town halls for UW Medicine every Friday. And of the medical leadership in the room, I actually have people start by talking about what they're doing to take care of themselves, because I think there is this perception that, okay, if you're the medical director, you're just up 22 hours a day. And, you know, I think it is good to normalize kind of that well-being piece. You're hitting on a huge tension that is, you know, and I think this is kind of our reality, that we've already been existing in a very resource constrained environment, and this has completely changed the game. And by and large, I think we're going to come out of it, and it's hard to even kind of get your head around kind of the financial implications for our institution, for our departments, of kind of this experience. So, you know, I'm guessing we're going to see a ton of hiring freezes for a long time. And you're right, there's going to be this kind of notion of there's extra work to do and we need you to be able to buckle down. I would like to see, and I hope that there is good support from kind of leadership across the institution to say that collectively we have to give each other grace, and we have to be able to be okay with doing the best we can right now. And so I would say when I read that, I'm like, I'm really sorry that it's frustrating that that's your kind of experience of the moment. But gosh, you are so not alone. I know many people are feeling like they're taking on more at a time when they're incredibly taxed. And I hope that we can kind of change that rhetoric to start with a thank you so much for doing what you're doing and for taking on as much as you are right now in a time that is incredibly tough to focus. And I think the career and collateral piece, goodness, I don't think we have a good sense of how this will affect us, but it's hard to imagine that the way in which we're all kind of coping and finding our pathway forward, I really hope that doesn't come away with kind of career implications if we have to take care of ourselves. But I know that that's actually kind of a huge stressor right now. And, you know, we have a ton of research faculty who their labs are on hold, their research is on hold, they're concerned about funding, and like all of that is hitting at the same time, again, that we're kind of navigating COVID-19. So it is kind of this multiplier of the stressors in our normal life multiplied by kind of the experience of the current reality. So hit me up again if you felt like I didn't answer that fully, but I'm sorry you're feeling that, and that is probably not an uncommon stressor in this moment. Yeah, just to echo that, you know, for faculty, hopefully this has gotten communicated to people, but particularly those who are assistant professors who are worried about sort of the path to promotion, just to remind people that there is available a stop on the clock, or the same way that we do for new parents. That it won't be automatic, but if you request it, the approval will be automatic. And that's a 1-year postponement in terms of the clock. And also that we're having a lot of conversations at the senior leadership level about how we make sure that, for instance, when we're looking at teaching evaluations, that we are recognizing that faculty are doing just a huge heavy lift right now in terms of learning how to teach online in a very short period of time, and that's been challenging. And we expect, you know, that we are going to have to make significant allowances for that. Those are things that we're talking about for faculty, and I think you know, maybe we should get together a group to sort of talk about some of the things that we can be doing to sort of set
staff's minds at ease as well, to make sure that you are feeling cared for, and that you are feeling like we are looking out for the fact that you guys are having a lot of stress in your lives as well. I guess I would encourage all of you to, just the way I encourage the people who are direct reports to me, to keep reminding your supervisors about that there are a lot of demands on all of our time right now, and people who are in those management positions, I count myself in this category, our kids may be older, and so we may not be recognizing I just can't even imagine the challenge of having a younger kid who wants every couple of minutes for input, and how disruptive that must be on a daily basis. And I encourage my folks to keep reminding me about that, because it's not my lived reality. But I can remember when I had a younger child, and remember what that was like. We also got a comment from someone saying, that there are also immense challenges for parents of young adults, whether they're undergrads or grad students who are now back in your house after not being there. There was a great article about that in the Wall Street Journal today that was super funny. So I'll try and make sure that we post that link. I mean, it's anecdotal, but sometimes it's helpful just to hear what other people are going through. And yeah, so I think, just continue to remind your supervisors that we are all human beings, and we are all in this together. And, I find it helpful to get those reminders. I think your supervisors will as well. And I think Anne had some great suggestions for supervisors. I'd say another one is just actually really checking in with people that you supervise to make sure you're aware of what's really going on for them. We so frequently in American society say, "How you doing?" and expect the answer to be, "I'm good, I'm fine." And, right now the answer usually isn't, "I'm good, I'm fine." So if you get that reaction from somebody, I think pushing back a little and saying "No, actually, really, how are you doing? What can I do to help? Are there things that we can, strategize together about things that we might be able to delay?" Those things are helpful. So let's see, I think we got one more. Yeah, we got from a manager saying that who really cares about their staff, encouraging staff members to communicate with their managers. We're all under stress, but it's our collectively we stand together. And a really nice one from Ellen talking about gratitude. I too share your gratitude for being in a state with an amazing governor who's making evidence-based decisions, and being in a city where I would say just where our public health practice partners are working so hand in hand with the government to make really good evidence-based decisions. It's been a joy. Yeah. Okay, let's see, what else do we have?
Mindful tech, I can
okay,
check.
we got one request that you include title and author for the Mindful Tech Use book.
I'll put it in.
So we'll put that in the key takeaways. So you'll get a link tomorrow, but you can always go to the website and download it as well. Yeah, Ian says it's David Levy Mindful Tech, but we'll make sure we put it in there as well. Okay, thank you for that. Any other questions for Anne before we sort of turn to other updates? So one final thing, Anne, I mean, you mentioned that article about grief, which I had also read and just thought yes, that's so true. Yeah. One thing that I have found is, like we say, ask people how they're doing, but don't really expect a detailed or honest answer. Yeah. It's just a perfunctory greeting. The other thing that I would say culturally that I think a lot of people struggle with is that in our society, a lot of people aren't really comfortable sitting with grief. and strong emotions. And so like the giving yourself permission to grieve, I think is that, maybe you could talk about that a little bit more. That can be sort of, that allowing yourself to have those feelings can be healing.
Oh, absolutely. And, you know, one of the things we've actually been running as kind of a on-the-fly training with some of our healthcare professionals right now is in thinking about peer support and active listening, all that. I've actually been starting with kind of a emotional intelligence and kind of the need to kind of give ourselves a chance to try and this will be a Viktor Frankl quote for you, but like essentially he says, let me see if I can remember it on the fly. But in essence, kind of you want to be able to create a gap between kind of the stimulus and response, and really be able to kind of choose our response to how we're reacting to things. And in that response lies our growth and our freedom. And I feel like that more than ever, trying to kind of give ourselves some space to kind of process and think before we respond is so important, especially as kind of those stressors rise. Another thing I've seen all too often is this notion that we have to be fine. You know, I certainly see it in kind of these clinical settings with nurses and physicians and, you know, environmental support folks who are on the floor all the time. It's hard for them even to debrief with each other in real time. So, you know, if you're on a COVID ICU unit and it's hard to kind of check in and be like, how are you? And actually allow yourself to go to that emotional space. So we've been hearing that, you know, often it's like at the end of shift in the parking lot is when people are actually able to kind of acknowledge what's just kind of taken place and how it's affecting them. And then often they'll feel like they have to pull it all together again before they walk in the door at home, and are okay again for their family. And I feel like that's an incredible stressor on people right now to find a way to be okay. And so that's kind of a bit of a gift to ourselves, really is giving ourselves an opportunity to process the emotional hard stuff that we are dealing with in real time. And I kind of often will say, essentially, like you can pretend that you can compartmentalize. Your brain doesn't actually work like this, but you can kind of give a Heisman to and hold at bay a lot of the hard emotional stuff, as long as you have enough resources to be able to fully extend your arm and keep it at bay. And I really worry that it's then when your resources are depleted and you can't keep your arm up anymore, as your arm drops, then all of that emotional stuff hits you all at once when you have kind of the least amount of resources to deal with it. So to me, I think it's been very powerful, and I loved articles like that, you know, that feeling you're having is grief, in that it kind of gives us some power to actually name what we're experiencing and to recognize that we don't have to be okay. We can actually just be like incredibly sad, and we can be disappointed. And our kids who are supposed to be graduating, or us if we're students, you know, we can be so frustrated that kind of the way in which we envision this spring and this summer is just going to happen differently. And I think acknowledging that suddenly, it certainly for me allowed me to kind of let go of a lot of expectations, and not let go of hope necessarily, but let go of kind of that the way in which I'd envisioned things. And now it's actually kind of started to let me kind of re-envision, you know, what, you know, 1B in the now, and start to kind of think about what can come from this and how can I think about recovery in a different way. I'd say that it's just so important to give yourself some time and space to feel and embrace those feelings and actually process them.
Agreed. Okay. Okay, it looks like we have gotten to the end of our questions for Anne. I wanted to thank you again. I also got I wanted to acknowledge we have in the chat box also just gratitude about spending some time to talk about well-being, and Anne, just really appreciating you coming and joining us today. You're welcome to stay on if you want to. And oops, it looks like something else just popped up. Yes, lots of thank yous to Anne. And really appreciative of you spending time with us, and of course all the work that you do. As challenging as all of this is for many of us, I can only imagine what it's like for those who are attendings in the medical system right now, or nurses, and working day in and day out and seeing sort of the really hard impacts that this is having on members of our community. So thank you for supporting them, and thanks for coming and joining us today.
Sure.
I wanted to turn it over. So thank you.
Thank you.
I wanted to turn it over to our associate deans to see if they have updates. Starting with Stephanie, are you there to talk about a little bit about educational updates?
Yeah, sure. Hi, thank you, and thanks to Anne. I really appreciate that. One of the comments that she made around having a routine and having something that we have to show up for, I think is really key and very much related to teaching, and especially remote learning. Having people show up for class and having some consistency in how we teach and learn and talk to each other, I think is really important, both for instructors and students. The one piece that I wanted to start with is just acknowledging that despite moving online and despite additional challenges, financial challenges, logistical challenges, housing challenges for our students and others, we noticed this week that our number of students, graduate and undergraduate enrollment, is comparable to other spring terms, and in fact is slightly up from winter term. So it's important to acknowledge that while overall enrollment seems solid, there might be individual programs or classes where we'll see some impact. And we won't know final numbers until this Friday when we do our official, I think we call it the census, the 10-day check-in into the term. So we'll know more about precise numbers early next week, but that is what we have so far. Another thing that I'm hearing is that some concern around sharing of our recording and sharing of our lectures and our course materials. And one piece that we wanted to emphasize is we have always recorded lectures using Panopto, and this is a really effective tool, especially for students who need additional time with the material or have some accommodations for different styles of learning. And it's just that remote learning is simply requiring that we do more of this now. One of the benefits of Zoom is that it is FERPA compliant, and there are a number of ways that Zoom follows privacy practices and technical security measures that are required, such as they don't share customer data, they don't share our recorded lectures, of course, they only retain information on our accounts until 30 days when we terminate our accounts. And we also have control over what screen names students use and who has access to the links of the recorded lectures. Those are only sent to those students who are enrolled in their class, and you can ask as an instructor that these not be disseminated and shared. And then the faculty and instructor can set in their account the number of days that the recorded lecture link is valid, and then it will be deleted. So there are ways to sort of at least minimize the sharing of course material. And if you have other concerns, feel free to check in with me. We also have on our SPH web link for instructors and students, under resources for instructors, we have a lot of information around Zoom compliance and how to minimize sharing of your course material. A few things that we have heard that works, and I welcome people to drop into the chat box or Q&A, things that have worked for them, both from perspective of faculty and students. We're now required to stare into a camera and talk to either little boxes or faces, and so mixing it up in terms of how we teach and deliver material is very effective, sort of short bursts of lecture or content, and then having activities and interactions. And the breakout rooms have been sort of consistently successful across faculty, and using the whiteboard for brainstorming, having students give feedback and input in real time. It's almost like using big flip charts in the classroom and writing down ideas as they're shared. And then of course, using the chat function and the poll functions to get immediate and quick input on a question that instructor might pose. So there are things that are working quite well, and feel free to share others with me or us so I can disseminate those out more broadly. The final piece I wanted to add is for the SPH web page that I referenced, and if anybody can drop that into chat right now, that would be great, or into the Q&A so people have that link. John Sharp added an upcoming events tab, and so there are resources for instructors and students to attend other webinars and trainings that are really widely available and open to everyone who wants to learn more about, you know, the current teaching and learning environment. And there was one that we just uploaded called Navigating Virtual Hate, Responding to Zoom Bombing. And that is tomorrow morning from 10 to 11:15 a.m. They're talking about ways to sort of combat hate and minimize the threat of Zoom bombing in this more open format of teaching and learning. So any other questions or concerns, just feel free to send them my way. Oh, here's an interesting question.
Oh,
can I?
Yeah,
can I,
yeah. Do you see that?
Can I try to answer it? Faculty have asked if there's a way to get a sense of if students are engaged or paying attention. Any suggestions? Yes. So I teach a class of close to 100 students, and as much as I would love for all of them to turn on their video, since they have to watch me, I would love to be able to watch and interact with them. And talked about, you know, we shouldn't shy away from social distancing, or physical distancing doesn't include, you know, not having eye contact anymore, which I think is such an important way to see how people are reacting to what you're saying, and we've sort of lost that. So I do polling, and I do questions. I call them quiz questions. They're not graded, but students have to drop answers in sort of real time as we present them in class. And it's helpful, I think, to keep everybody paying attention and focused on the content as it's being delivered. And I've had no problems with participation in those. You can actually see how many people respond to the poll. If there were only 30% responding to my poll, I would wonder where the other 70% were, but usually it's right around 85+%. So we know we have at least 85+% paying attention to the poll questions. And then there's also a function which I don't use and I don't have a whole lot of faith in, but there's a little, you can actually set an attention tracker in your Zoom profile, and you can track a little clock pops up if students are distracted and they're on another page. So if they're not watching your Zoom delivery, then you can see a little clock pops up and they're doing something else. That's tricky because they're also looking at PowerPoint slides, and they might be Googling additional information or filling out a Canvas quiz. So I don't rely on that. I just hope for the best.
Thanks, Stephanie.
Thanks.
Okay, looks like we got all the questions for you, but if we have more, we'll come back to you. Lisa, do you want to give an update on research issues?
Sure, I'd love to. And before I launch into it, I just also want to say that I really appreciated Anne's presentation. And particularly what hit me today was the discussion about us grieving things. And I know that a lot of us who have had our research programs put on hold are really grieving that right now. And I would put myself in that category as well. And I also want to take a page out of Anne's recommendations and remind myself of the things that I'm grateful for. And I really am grateful for all of the efforts across the university and really nationally of people advocating for additional funding for future supplements, with the goal of actually covering some of these costs that we're incurring while our research is halted, so that when we can restart our programs, we'll actually have the resources to carry out the projects and research that we originally engaged in. When I'm successful at remaining optimistic, I am optimistic that we are going to be able to get back and re-engage in our research. So I just have a couple of updates. This week saw a revision to the definition of what's been called essential research. This is research that's permitted to continue under Governor Inslee's stay-at-home, stay-healthy initiative. This was updated to include a technicality, but it's actually a generous technicality. It now includes all activities that can be reasonably justified as important for developing biotechnology-related therapies. And that sounds like nothing that anybody does. In the School of Public Health, or not very many people, but biotechnology-related therapies are very broadly defined as virtually anything that's used to treat human health problems, and they don't have to be directly related to COVID-19. If you have a project that meets these criteria and also meets the criteria for being able to conduct in-person human subjects research, feel free to do some exploring and check in with human subjects and see if your project can actually re-engage. The Population Health Initiative call for proposals did materialize. This was released this past Monday. It's a rapid response and a very short timeline. The submission due date is April 16th. And they're providing up to $20,000 for projects of about 4 months duration. There is a lot of encouragement for interdisciplinary projects, as well as those with a commitment of matching funds. And the School of Public Health has committed to a substantial match for projects led by an SPH faculty member, as well as a match for projects in which the faculty member is a co-investigator. We've distributed information on how to request this match through your departmental research council member, and you should feel free to reach out to either them or to me directly if you have any questions about that. And I think that's it. Thanks very much. I'll be happy to answer any questions if there are.
Thanks. Any questions for Lisa? Yeah, so a couple people commented that for some reason they can't see each other's questions today. And I'm guessing that has something to do with, Zoom changed all of the default settings for us as part of their security measures. And so slowly we're uncovering the things that they've changed the settings on and having to figure out how to reverse them. So thank you guys for mentioning that. Since I'm a panelist, I can see the questions. And so I actually didn't realize that that was the case, but we will look into how to fix that. Oh, here we go. Woohoo. Watch this. You guys should be able to see them now. Can you see them? Anybody? So you can give a thumbs up to the people asking for it to be changed, the settings to be changed. I think I just fixed it. Okay, and then I was going to see, Janet, do you have any updates that you want to provide on practice stuff or anything like that?
Sure. Hi. So yeah, I think last week we talked about some of the new data visualizations available on the county's website and also the state's. And then I think last week also the Seattle Times had reported about like some data lags. So I wanted on the state's website. So I wanted to give a little update and let everybody know that that those have been improved. So if you go to the State Department of Health's website now, you'll see that their reported data flow has updated, so you can look at a lot more updated information, including EpiCurve data and hospitalizations and deaths and testing, just all kinds of stuff. And you can look at some of that by county, which is really helpful. So I think the last update so it differs by date depending on what the data source is, but the last update was in the last couple of days, which is great. So I wanted to talk a little bit about some innovations because I got contacted when I gave the update last week about the drive-through testing in different counties, which some people seemed excited about. So I just wanted to update that within the last few days, actually, there's been a transition at the state to electronic case and contact investigation, which if anybody ever has been involved in case and contact investigation the traditional way, you'll know what a minor miracle this is. So that's really exciting. As far as our requests for support from our practice partners, we've had some recent requests for faculty help with specific areas of expertise. And then there are probably some enhanced surveillance activities coming online that we may be asked to help with. And then these new case and contact investigation work processes. And these are all new activities that I'm in discussion with our partners around, and we'll keep you posted. And then in the spirit of our presenter's theme of gratitude, and then also the commenter who was talking about feeling lucky to live in a place where we have, you know, the governor and leaders kind of talking to us about like evidence-based decision making. I wanted to tell everyone a funny story. So I talked to a reporter today, and the media this week wants to talk about like when we're going to get back to normal. When are we going to get back to normal? And last week, everyone talked about flattening the curve. So so today I was trying to talk to him about, you know, what the new normal might look like. And he was like kind of trying to get me to talk about things that were like, you know, political decisions. I didn't want to talk about those. And I kept telling him, you know, I'm going to stay in my lane. I'm going to talk about, you know, public health stuff. And he said, well, hypothetically speaking, if you were a political decision maker in a, you know, fictional city, you know, how would you make this decision? And I just sat there and I was like, well, first of all, no one's ever asked me that question. But as I was trying to think about it, and I told him I didn't want to, like I didn't want to be a hypothetical politician. But what came to me was that I would do it like our leaders have been doing it, which was like so awesome. And I actually said that to him. I was like, oh my God, you know what? I would do it the way our leaders have been doing it at the, you know, city of Seattle and the and King County, and at the state level. Just the discussions about evidence-based decision making has been so wonderful. So just wanted to tell everybody that story. That's all.
I love that. I agree with Janet. I think, you know, we are incredibly blessed to be in a city and a state, city, county, and state, where our elected officials and we have the best public health practice groups here that I know of, but it's just so heartening that they're working hand in hand effectively with elected officials and helping them to make really great decisions. So I don't know if any of the people from Public Health Seattle and King County are on the line, or Washington State DOH, but if you're there, we love you. And we know you guys are taking on a huge burden, and we just appreciate you tremendously. And we got in the comment section some hearts for Janet's enthusiasm. Okay, so in the last couple of minutes, there's a question that we got at the very beginning, and I promised we would come back to, which is, what's going on in terms of projections about the future, given that not all states are doing stay-at-home orders? And is it possible that we might have to go through this process all over again due to no national mandate? So, yeah, so I would say yes. That is our current understanding, is that based upon the modeling that we have seen, and you can go and check out the webinar from last week, where Catherine Peebles and Ruanne Barnabas did a really tremendous job sort of going through different scenarios in terms of what might happen if we lifted social distancing measures too early, or physical distancing measures too early. And yeah, so what we sort of expect, and this is part of why we're watching what's going on in China and some of the other Asian countries that were earlier in the epidemic than us and are now at the point of being able to start lifting some of those restrictions, watching to see what's going to happen. But because you know, the way that the physical distancing measures work is that we prevent people from being exposed. And so that means that there are going to be people out there when we get back down to the flat baseline part of the curve who are still susceptible because they were never exposed to the virus. And so it does mean that we expect to see some upticks again for any number of reasons. So that could be they're asymptomatic carriers in our local population that maybe if we aren't testing comprehensively enough, that we wouldn't be picking those people up, or due to travel influx. That's what China is worrying about a lot now, is sort of influx of people from other areas that are at the peak, or who do still have community level transmission going on. The influx of people from the outside, that could cause new cases to take off. So it's not just a question of other parts of the United States not implementing as many restrictions. It's also that there are other areas that are getting hit later than we are, and so they will rebound later than we will. So those are all things that I think, you know, our practice partners and our elected officials are still trying to figure out is what's the best way to sort of ease up on some of those restrictions without letting up so much that we see a huge resurgence in terms of cases. And that may mean that we have little resurgences and that we have to re-implement some restrictions, and trying to figure that all out is sort of a big part of the next step. The other big uncertainty is whether or not this is something that's going to circulate globally and seasonally the way that we see with seasonal influenza. We just don't know if that's the case. And so that's another thing that might cause us to see another increase at a later time that we would have to respond to again. And you know, the thing that would really help, and we do have people working on, is if we were to get a vaccine out that would help us to create greater immunity across the population, so that those people who hadn't been exposed during this first round were then protected. And of course, also more effective treatments or prophylactic treatment regimens like the clinical trial that Ruanne talked about last week. Those are other things that obviously we're watching carefully, and there's a lot of groups working on them, and we're really hoping that those will pan out and that we'll be able to buy ourselves time to be able to implement those. Okay, let's see, other questions. Someone asked whether I have a sense of whether we are likely to work remotely through the end of May. So based on the current IHME modeling, and you know, they're adjusting it not day by day, but relatively frequently as the new data comes in. So I would guess the answer to that would be yes. I'm not, of course, not the person who gets to make that decision. So that decision will be made, obviously, at the level, the governor's office level, whether or not we're continuing to have stay home, stay healthy, and then at the campus level by Anna Mari and the provost. But their decisions are very much informed by public health, Seattle and King County, who are obviously also using the same data sets that the governor's office is using and the same modeling to make decisions about that. But it would not surprise me if we would be working remotely through the end of May. Okay. Someone said, if there's still time, can someone review the new guidance on Practica that came out yesterday? Stephanie or Juanita, do one of you guys want to talk about that? Or Janet? Anybody? Not quite sure what that's referring to.
Yeah, I'm not sure either. This is Stephanie. Janet, do you know?
Yeah, I do. Yeah, it's actually kind of a lot, so I don't think I'll really have time to go over it all. So Molly, if you want to send me an email, I'd be happy to respond in more detail. But like the kind of nutshell version is that if you have students that are who are graduating in spring or summer, we're being like majorly flexible with kind of the applied practice experience requirement. But for students that are not set to graduate in the spring or the summer, we are kind of looking toward expecting that people will still do an applied practice experience, but having flexibility in what that might look like moving forward because of the uncertainty of the situation.
Okay. Thanks, Janet. Okay, I see some lovely comments. One about suggesting people, Jim, if you could send us the link to those articles about correlation of rapid and prolonged public health interventions on lowering excess mortality rates during the Spanish flu epidemic in 1917-18. We will share those with people. And yes, someone calling out, like, all of the great work that's going on in Washington is not by accident. I've been calling out our local health department, but WSALFO, our environmental health directors, the public health nursing directors, and all our local health departments and the legislative staff members are just doing amazing, amazing jobs, super heavy lifts. We are incredibly grateful to all of you. So thank you all for everything that you're doing. Someone else said, any thoughts about when UW might end the work from home order? Again, so we're taking our cues there from Public Health, Seattle and King County, and the governor's office. But you know, if in terms of things to be looking for, we would need the number of cases to come down, if not to baseline, at least close to baseline, so no new cases, or very small number of new cases, such that we could be confident that standard conventional contact tracing and quarantine of individuals known to be affected would be effective at keeping us from having new upticks. And that's also dependent upon us having comprehensive enough testing that we could be confident that we were catching all the asymptomatic people as well. So those are pretty high bars. So which is why I was saying, yeah, I don't think that's going to happen before the end of May. But those are sort of the things to be watching for. Let's see, what other questions do we have here? I think I've gotten them all here. Whoops, something just popped up. Okay, no, it's just that Jashawn is deleting ones that we've already done. Okay, great. We are at exactly 4 o'clock, or 3:59. I wanted to thank everybody for participating today, and particularly Anne for coming in as our guest and offering us some words of calming wisdom and about how to manage this incredibly stressful time and support each other through it. And of course, all our regular panelists and all of you guys for asking good questions and sharing good resources, and we'll make sure that we get those into the key takeaways for you guys. Thanks to everybody. Thanks, Anne. And I will see all you guys next week.